Hi, doctors. My name's Colette. I'm 45 years old, and I've got 2 beautiful kids. I love to play tennis, and lately I've had a lot of searing pain in my arm after I hit a ball. I'm really concerned it may be tennis elbow. Not only does it hurt after I finish a tennis match, it hurts when I do regular activities. I tried acupuncture, and I'm wondering if there's anything out there that doesn't involve me going under the knife.
Colette is here along with physiatrist Dr. Steven Sampson. He's a pioneer in a new non-surgical treatment that just may help her. It's number 3 on our list today of ways to rebuild your body. It's called platelet-rich plasma therapy. Thank you both for being here.
Thank you for having me.
So, I'm very excited about this therapy. Obviously, at this point, it isn't scientifically proven, but can help so many potential problems, right?
That's correct. It's a procedure that we're using for both tendon injuries and arthritis. And basically, tendons connect muscle to bone, and we all have tendons throughout our body. For example, with Colette, she's complaining of some tennis elbow. But interestingly, of all the patients with tennis elbow, only 5% of them actually play tennis. Most of these injuries are from repetitive overuse injuries like lifting the laundry, a hairdresser turning her wrist in the improper position. They're all repetitive overuse injuries. So there are applications for everybody at home in the weekend warrior as well as the elite athlete.
So whether it's a tennis elbow, jumper's knee, plantar fasciitis, this has hope. So first things first, let's verify this diagnosis that we think you have tennis elbow.
Okay.
So the first thing we do first is ask the patient if they have pinpoint tenderness on their elbow, which is the point where all the tendons connect from the muscle to the bone, which Colette clearly has. Secondly, we have diagnostic musculoskeletal ultrasound. Like looking at the baby, we're able to look into tendons and see if there's irregularities.
So we're going to slap the ultrasound on there. And what's great about this is it's non-invasive, and we're going to get a look at hopefully her tendon and see if there's any abnormalities.
Tendons by nature have poor blood flow and develop scar tissue and form calcium deposits. And so what we can see here where the arrow points on the screen is a calcium deposit. It's initially believed to be a problem of inflammation where the tendon's red and hot and angry, but after 4 to 6 weeks the tendon changes and it's a problem of poor oxygen and blood flow.
And so we can also look at blood flow to that area to see if maybe there's some increased blood flow, which would be typical after an injury like she's been dealing with, correct?
Correct. And so typically you do not want to have significant blood flow in a tendon, but there's a theory that the tendon has increased flow in areas that have injury. And so what we're able to do is zoom in on the tendon and use color Doppler and see if there's some increased flow and irritation of her tendon. And so we can clearly see in the tendon there's some irregular flow, and typically in a tendon you don't want to see any of this blood flow.
So you have tennis elbow. We verified that. The problem with tendons is very difficult for them to heal on their own. And that's where platelet-rich therapy is potential cure. Now, again, traditional treatments, steroid injections, taking anti-inflammatory over-the-counter pills, rest, ice, which are great, but this treatment, Hines Ward used it before the Super Bowl to get a quick recovery. But the weekend warrior, it's good for them too.
That's correct. So through this treatment, we're able to promote healing naturally without any adverse effects of cortisone. Unfortunately, cortisone, when injected into a tendon, while it may give short-term relief, the pain can come back stronger, and we found that the tendon can actually rupture and tear from repeated cortisone use.
You've got some props behind you there, do you not?
Exactly. So I like this image of this hand here, and basically you can see the elbow. And so a tendon connects a muscle to a bone, and the tennis elbow comes across from all these tendons of the wrist and attaches here on the bone. And this is the point of injury in most patients of tendons because they rarely get to rest and have poor blood flow and develop scarring, and as we saw in the ultrasound, calcification. Basically what we do is we do a procedure where we draw blood from the patient's arm. We take their blood, we spin it in a machine called a centrifuge. We filter out their platelets, which are rich in the body's natural healing properties called growth factor. And then under ultrasound guidance, like looking at the baby but looking at the elbow, we basically inject the patient's own blood platelets directly into the tendon to promote healing and regenerate the tissue.
And so this is still in studies as far as being scientifically proven, but how many treatments has it taken to improve Colette's
Most
symptoms?
patients like Colette would benefit from a single injection. However, we tell patients with significant injuries over years, they may require between 1 to 3 injections. And these are typically spread out at about 4-week intervals.
And what I love about this is it's your own platelets. There's no foreign injection of anything else. So if this does prove to be as beneficial as it has been in your practice, this is something that a lot of people at home might get benefit from. Colette, I'm sure you're wondering right now, well, can I have one of these injections?
Absolutely. I want to try
You have to
it.
ask this guy.
No problem whatsoever. I'm confident we'll be able to help you out.
Terrific.
And this treatment's really revolutionized the way I approach patient care. And the idea is maximizing the body's inherent natural ability to heal itself. It's part of a whole field in medicine, regenerative medicine, opening the doors to stem cells and various treatments where we're realizing that we can unlock some natural healing. And basically by increasing blood flow and oxygen, we're kickstarting healing. And Colette seems to be a good candidate.
Well, many years ago, I had multiple injections in my knee, and I wish we had had something like this back then because there are all those other worries that you have. So I'm very excited that you're using this. Good luck with you.
Thank you so
Dr.
much.
Sampson. Thank you very much.